Hello and welcome to this class on reactive skin. Let's start by defining the word reaction. A reaction is a physical response from an internal or external stimuli. As a therapist, at some point in your career, one of your clients will experience a form of reaction to a product that is used on their skin. Now, this doesn't matter whether it's on the hands or the feet, on the face of the body, and it can apply to absolutely any brand of products that you use. But it's ensuring that all necessary elements are considered to prevent a reaction from occurring in the first place and knowing how to deal with a reaction if it does occur. This will make all of the difference to your client's well-being. In this class, we will identify the characteristics and types of skin reactivity. We will identify possible causes and triggers of reactions. We will learn what to do if a reaction occurs, and we'll also learn how to deal with the after effects of a reaction. We're going to look at the different forms of skin reactivity, beginning with irritation. Irritation is also known as irritant contact dermatitis. And this occurs when the skin becomes irritated to an ingredient which it struggles to tolerate. Now, it's very important that we understand that irritation to ingredients is more common than you may think. And many ingredients can cause irritation on the skin without it being an actual reaction. So, for instance, if we think about ingredients like vitamin A, aka retinol, this has a strong irritation potential when it's used. However, if irritation is caused by this, it doesn't actually mean the skin is having an allergic reaction. The same applies with glycolic acid. When using high concentrations, this can cause the skin to become irritated. However, the client is not having a reaction. So it's understanding from the start the difference between reactivity by irritation or allergic reactions. If your client experiences irritations, the symptoms may include stinging, burning, redness, a mild rash, inflammation, or heat. With irritation type reactions, it is usually confined to the area of skin where the trigger ingredient was applied. And we generally find that irritation appears very, very quickly on the skin. We're next going to look at allergic reactions. Allergic reactions are also known as contact dermatitis. These are an immune response to a skin invader. An allergic skincare reaction occurs when the immune system overreacts to a substance which is applied to the skin. It's the immune system which protects the body from allergens. In some people, certain ingredients are seen as allergens by the body, which then trigger the production of antibodies, which then go on to travel to the cells, causing the symptoms on the skin. Now, it's worth noting that the first time a person with an allergy to an ingredient is exposed to the allergen, it may not cause a reaction. However, the person is then sensitized to the allergen, and upon next use of that product, can then produce an allergic reaction. If a client experiences an allergic reaction, symptoms may include inflammation, severe itching, swelling of the area, excess heat, blistering, or even hives. This could affect other areas of the face or the body as well as the area that the product was topically applied. With allergic reactions, they sometimes can appear quickly on the skin or may not appear immediately but developed over a delayed period of time, even up to 24 or 48 hours later. Photosensitivity reaction is also known as photodermatitis. This is an abnormal skin reaction triggered by ultraviolet light. The symptoms may include burning, severe redness, swelling, blistering, an acute rash, and peeling of the skin. Photosensitivity reactions can be caused by taking certain medications, such as antibiotics, or by the topical application of certain ingredients which are then triggered by ultraviolet light. Some essential oils have the capacity to cause photosensitivity if they're incorrectly used, for instance, by neat application on the skin or by wrongly advised by an untrained therapist. At Eve Taylor, we never condone them being used neat on the skin and definitely do not advise high concentration blends being applied to the skin before exposure to direct sunlight. Photosensitivity reactions usually appear very quickly and they will appear very acutely. There are a number of possible causes to irritation or skin reactions which we're going to be investigating. These include a compromised barrier function, specifically over cleansing or over exfoliation and dehydration, menopausal skin, ingredient allergies or intolerances, incorrect product use, out of date or expired products, and sensitivity, sensitization, or allergy prone skin. We're also going to look into additional considerations such as the client being premenstrual, being pregnant, certain medications that could be taken, or the use of recent dental injections. One of the first and foremost considerations for any type of reaction occurring is a compromised skin barrier function. As you well know, the skin's barrier function is defended to keep allergens out. If you look on the screen on the left hand side, you'll be able to see that if the skin's barrier function is working correctly, it's going to stop any potential irritant or allergens from penetrating into the epidermis. However, if you look on the right side, if there's a compromisation issue with the barrier, it creates a direct pathway for irritants and allergens to penetrate into the skin, ready to cause a potential reaction. Over-cleansing. If the skin is cleansed too often, then the protection the skin gives us can start to be weakened. So if we cleanse too harshly or use water that's too hot, then this can cause damage by breaking down the essential protective lipids. Using soaped base cleansers or strong detergent foaming cleansers, or even a cleanser that's inappropriate for the skin type or condition, for instance dehydrated or dry, then these types of cleansers will remove the components of the lipid bilayer barrier and create cracks in the stratum corneum. This will then allow irritants to invade and cause a high chance of reactivity. Over-exfoliation. So if exfoliating too often, exfoliating with harsh products such as those with coarse seeds, or using exfoliators which are too aggressive for the skin condition, like highly active hydroxy acids at a high concentration, then this will cause damage to the protective skin layer, which again is designed to defend us. This damage can then induce irritation and inflammation, make the skin more sensitive and reactive to those irritants. Skin dehydration. So there are a number of factors to skin dehydration, over-cleansing and over-exfoliation as we've just covered, but the lack of topically applied moisturisers will impact greatly as the skin is dependent on these being applied to keep it in its optimum condition. Any of these elements can create small cracks in the stratum corneum. When this happens, essential water is lost, meaning that enzymatic reactions which allow the cells to shed appropriately don't happen. The skin cells then become more disorganised, which leads to barrier impairment. Then again, irritants are able to invade, causing damage. The menopause. With the onset of perimenopause heralds a huge change within a woman's system. The fluctuating hormones cause body-wide changes, including a drop in moisture and essential fatty acid levels. The drop of fatty acids leads to a weakened barrier function, with irritants and allergens more able to penetrate the skin layers and sensitivity being experienced. The capillary system will be busy with hot flashes, and studies have shown that after the age of 50, the pH level of the skin gets higher. pH 5.4 is where the pH of the skin allows for optimum operations of our microflora and defensive cells. As the pH levels climb, those cells are then less able to help defend the skin and is more prone to rashes, sensitivity, and also dermatitis. Hormonal changes within the body alter the way that our internal system works. So skin that's never ever reacted before can actually start to become easily irritated. Often, clients can use a product for a number of years with no issues whatsoever. Then, all of a sudden, can start to experience sensitivity to the product. It's not the product that's changed, but it's the internal chemistry that has altered, and it leads to this type of reactivity. Now, with ingredient intolerances and allergies, unfortunately, as human beings, we are highly individual and we may encounter an ingredient or ingredients which our skin can just not tolerate or has an allergy to. So, if we think about other types of allergies, so for instance, if we think about animals, some human beings have allergies to animals, but the animal hasn't done anything wrong. It's not the animal's fault that we have the allergy to them. And same goes for pollen. The flowers and the bees haven't done anything wrong, yet many of us have high allergy to that pollen. So the same applies to skincare ingredients. Just because an ingredient or a product doesn't agree with somebody's skin, it doesn't mean that there's anything wrong with that product. It's just us not liking or being able to tolerate it. Unfortunately, we just have to find out by trying the different products, finding out which works the best for us. Now, incorrect product use is a very, very big consideration to make as well, especially with clients that cherry pick products. They can use products that are inappropriate for their skin type or condition, and these products could be highly active and just not suited for them at all. Just because your client has said that they want a really deep exfoliation does not mean that you should reach straight for the bio cream exfoliants. For many, a product at this strength would be too active for their skin, and if the skin is compromised or has high sensitivity levels, it would cause reactivity. And so, taking a more gentle, progressive approach and choosing a product such as microfine exfoliant would be recommended to avoid any of these potential issues. Using any type of incorrect product could over dry, strip the lipid bilayer of the skin, and then cause irritation and sensitivity. Incorrect products can also have an overstimulating effect, which leads to irritation and sensitivity. Out of date or oxidized products. So, products open well past the recommended time, or products exposed to oxygen which have oxidized. Skincare products are just like food, they go off. If the product is out of date, then it is no longer stabilized. Oil-based products will go rancid, and water-based products will start to harbour bacteria and mold growth. Using out-of-date products will cause irritation and infection. If you consumed rotten fruit, vegetables, or any other food that had gone past its sell-by date, you are highly likely to become poorly. If you put ingredients on the skin which have gone off, then the skin too will become poorly and react. Sensitive and allergy-prone skin. This type of skin is prone to impaired barrier function and is already highly reactive to irritants and allergens. The immune system on those with highly sensitive or allergy-prone skin will be on high alert with a high level of histamine already within the system, and so will identify any potential new trigger allergens, often unnecessarily. As the skin may be sensitized from previous irritation or reactions, it is more likely to react to a new ingredient when it's first introduced. Additional considerations to make. Menstruation. The skin can become hypersensitive in the 3 days pre and post menstruation. We recommend that a client doesn't try a new skincare product within these days, as the skin is more likely to react. Pregnancy. Hormonal fluctuations during this time can cause hypersensitivity within the skin. Whilst our skincare products are absolutely fine to use during pregnancy, it's often best to be mindful and use the least stimulating products like ultra soothing for the best treatment outcome. Medication can cause hypersensitivity and photosensitivity. Things such as antibiotics, corticosteroids, or recent anesthesia can have an impact on our system and make the skin hypersensitive or more prone to reactivity. Recent dental injections. Now, these are injected into the body as an antibody, and these dental injections can cause hypersensitivity within the face area, even up to 2 weeks after. Experience has shown us that something as simple as going to the dentist for treatment can have an impact and cause reactivity. And this is why we advise to go through a thorough consultation, as it's essential to ask all of the relevant questions which could impact. So, how can we reduce the possibility of a skin reaction happening? Now, whilst at some point in your career a client's skin may react to something used on it, using due diligence with common sense, care and consideration can greatly reduce the possibility of an issue arising. Carrying out a full and thorough consultation using the Eve Taylor consultation card will help to identify any potential red flags. Don't skimp by, as essential questions are asked and vital answers will be given which could completely change the outcome of the treatment. Skin profiling analysis will physically determine the condition of the skin, and carrying out this thorough skin analysis is essential so you can determine the exact condition of how the skin is currently behaving. We can never just go by what the client's own perception is. You may well notice that the skin's barrier is compromised, and it will allow you to select the appropriate formulation for their needs. If ever in doubt, there's nothing wrong with proceeding with a gentle treatment approach, omitting the use of more active products. It'll allow you to evaluate and then proceed with a more active approach at the next treatment. What should you do if a client reacts? Firstly, don't panic. Thoroughly remove all product from the skin and apply a cool, damp pad or a cool compress to the affected area. It's very, very important that you reassure the client. If it appears that the skin is experiencing irritation, which is likely to be confined to the area of application, then you may consider applying a thin layer of ultra soothing cleanser for 5 to 10 minutes. This will help to reduce inflammation, redness, and stinging. Once the skin calms down, we would then protect by applying ultra soothing moisture cream only. In the highly unlikely event that the client experienced irritation from an ultra soothing product, then we would not reapply this. Do not apply any other products than those already mentioned. Now, whilst it may be very tempting to apply soothing mask or soothing moisture lotion or a product with calming essential oils, these are to be avoided. The reason being is that you may be reapplying the trigger ingredient. The ultra soothing products are specifically formulated to be used should irritation occur. If it appears that the client is experiencing an actual allergic reaction, or you're just not sure what kind of reaction is happening, then we recommend to thoroughly remove all product from the skin and apply cool damp pads or cool compress to the affected area and leave for at least 10 minutes, but do not apply any other product. Never offer to dispense or advise the client to take antihistamines, as we are not medically qualified. While this may seem the right thing to do, if your client was to react to a medication you had dispensed to them or advised to take, this could have severe repercussions to you. Request that the client visits their GP or seeks medical attention, and if appropriate, they will prescribe and dispense antihistamines. In the case of a client experiencing a reaction, it's very important that we, as therapists, review our actions and what happened to ensure that we did everything we could to prevent the incident happening. We need to ask ourselves questions like, was there anything that I did which may have had an impact? We've got to be honest with ourselves so that we can reflect upon this and make necessary changes for the future. Things to consider would include at what stage the reaction happened, so you can assess if there was any specific product that caused the issue. Were all the products used appropriate for the skin type and skin condition? Had a full and thorough consultation been carried out? And had a thorough skin analysis been carried out? Ensure that you record full, clear and concise details of the incident in your own records so that you can refer back to the information if it's requested at a later date. If a reaction more than irritation occurs, then we would ask that you contact us here at Eve Taylor on 01733 260 161. When you call up, you must have the fully completed Eve Taylor consultation card to hand so that we can assist you and make a record of the issue. If you don't have the relevant information or consultation card to hand, we will be unable to make a full record and you will need to call back at a later date once you have that information to hand. We also recommend that you contact your liability insurer so that the issue can be officially recorded by them. You'll be able to use the opportunity to seek their further advice and recommendations, and they'll be able to advise you on what steps to take next should your client wish to escalate the incident. We hope you've enjoyed this online class and that it's given you some good, solid information and considerations to make, and will help to infuse confidence into you as a skincare therapist.